Hi, last we've got a couple questions about suboccipital muscles and how they relate to eye movements. And yes, it's usually covered in 6 and 7 how these interrelate. So let's think about it a little bit. We have the rectus, capitus, posterior, major, and minor. Now their orientation running from the spinous process of C2 and C1 respectively to the occiput. These are muscles, think of extension. And if I want to inhibit them, craniovertebral flexion. So let's think of craniovertebral joints and the suboccipital muscles. So activation of the crania of suboccipital muscles, again, we're going to look at there is craniovertebral extension. We're going to look at an anterior extension glide of the occiput on C1. So if in the forward head postures, we have that hypertonicity in the suboccipital muscles. One way to inhibit it is with the patient supine is you can try and have them look down. So this will help to kind of inhibit suboccipital muscles, and if testing the craniovertebral joints, occipital and C1, it is sometimes helpful to kind of eliminate that muscle tone as your end feel. So let's say I have a tight barrier on the right side with craniovertebral flexion. One of the feelings I could have is a tight muscular feel. So having the patient look down a little bit and change their gaze down subtly should inhibit the muscle tone and should change that end feel for me. So it's a nice reflexive way to do it. I usually use this with basically deep neck flexor exercises as a way to inhibit so I don't get too much sternocleidomastoid.